Now to Sweden, where the government has been granted special powers to try to curb the growing spread of COVID-19 in the country. Prime Minister Stefan Löfven will be able to approve urgent bills related to the health emergency without going through Parliament. This will allow him to close businesses or schools if he deems it necessary. Stockholm has so far stopped short of introducing a lockdown, instead advising residents to maintain social distancing measures. Well, for more on the situation in Sweden, let's go to Stockholm to speak to our reporter Per Nyberg. Morning to you. So the government have got new powers. Are they likely to use them? I guess that's the secondary part of the question, because cases do seem to be rising in Sweden. If they do use these new powers, is it sort of a U-turn from the government's perspective?
Well, good morning, Rosie. If they were to use these powers, it would certainly be a U-turn, because for now it's still the advice from the government: stay at home, try to maintain social distance. If you show any sort of symptoms, you should definitely stay at home. But for now, it's not likely to see this sort of U-turn, because even though the numbers and figures are rising, they actually expected more of a bigger rise following Easter. But they're saying that it's sort of a trend that they're seeing, that things are actually sort of calming down. But they are still warning people, don't take this as a sign that we're sort of past this. The Prime Minister said, don't expect this to last for months. This is not something that's going to just be for weeks. This will take months. Just yesterday, the government extended the travel ban, locking down the nation's borders, just like the rest of EU, for another month. We've also heard from the Stockholm region telling people to avoid public transport. They are actually concerned that too many are using public transport. For now, they want people to get off public transport, allow public transport to be used for healthcare workers instead of everyone just sort of being out and about and enjoying the sunshine, going to work. But for now, we're not seeing any sort of alarming rise in the number of deaths in Sweden. They're hoping that the next couple of months will show that the Swedish version of handling the crisis has been the right one. The key concern, I'd say, for the government now are still nursing homes. About almost half of all deaths in Sweden are deaths stemming from nursing homes. So that's where, when we're past this whole pandemic, they're going to have to investigate how on earth did this happen.